Everyone's obsessed about getting into Harvard Medical School. But you know what's wild? Most med school applicants are optimizing for the wrong thing. Hey, what's up, everyone? I'm Dr. Riz from Cracking Med School Admissions. I went to Princeton, Stanford Med, and then did my residency at Harvard. I worked with Harvard undergrads, med students, and faculties for more than 15 years. And I'm about to tell you something that will completely change how you think about applying to HMS. For the HMS class of 2028, Harvard interviewed 757 people out of 6,856 applicants. That's 11%. Sounds brutal, right? But once you get your interview, your chances jump up to 22%. Yes, read that again, 22%. Your entire Harvard application should center around one goal, and that's how do you get one of those coveted interview slots? Leadership and impact. The Harvard Medical School Admissions Committee is asking an important question as it evaluates an applicant. How has this applicant already made healthcare better? Leadership at Harvard means seeing a problem and doing something about it. It's when you notice your free clinic constantly runs out of supplies and you create a donation system that keeps it sustainable. It's when you realize your community health fair isn't reaching non-English speaking patients, so you build a translation team and double the attendance the following year. Leadership is when your lab keeps hitting dead ends, so you design a new data collection protocol that saves months of research time and helps the entire group publish. And yes, Harvard definitely loves global leadership too. Maybe you partnered with a rural clinic abroad to build a telehealth network, trained local health workers, or collected data that helped secure grant funding for maternal health supplies. That's what Harvard wants to see, tangible results that improve real people's lives. Harvard loves applicants who don't wait for permission. Harvard loves applicants who build solutions, bring others along, and leave systems stronger than when they found them. When you write your experiences on your HMS secondary or discuss your experiences on interview day, focus on what you changed and the impact that you had. That's the difference between participation and leadership. And remember, Harvard trains people and recruits faculty members who will transform healthcare through science, systems, or service. Show Harvard that your story already points you into that direction. How to submit strong letters of recommendation. First, let's talk about strong letters of recommendation, a super important part of your Harvard Medical School application. A strong letter doesn't just say you're smart or hardworking. Those words are really a dime a dozen at Harvard Medical School. A strong letter proves you've already demonstrated the qualities Harvard values. Leadership in action. You need to strive for your recommenders to say something like this. I've worked with hundreds of students, and she's among the top 1% I've ever mentored. How can your letter of rec writers show your leadership? You want letters that include stories and specific examples about why you are excellent, not just summaries of what you accomplished. For example, a powerful letter of rec would say something like, when our lab's main experiment failed weeks before a major deadline, Johnny reorganized the team, redesigned the protocol, and helped us generate data good enough for publication. The best letters come from people who know your character, your initiative, and the impact that you've made. Professors, PIs, and mentors who have seen you think and lead. So before you ask someone for a letter, ask yourself, did I give this person enough substance to write something memorable? Because at Harvard's level, the committee isn't just looking for competence, they're really looking for excellence with evidence. Harvard's secondary application. How to write a strong Harvard secondary application. At Harvard's level, everyone has a great GPA. Everyone crushed the MCAT. What can separate you to be at the top 10% of applicants are your Harvard secondary essays. So let's discuss how to stand out on your Harvard secondary application. You know it's not explicitly asked on the Harvard secondary? Why Harvard? Many other top schools like Stanford does ask, why this medical school? But at Harvard, nope. But that doesn't mean that you shouldn't write about why Harvard in your Harvard secondary. Let me show you how. Listen to this, and this is super important. Harvard doesn't want to hear you praise and glorify the institution. I've read so many first drafts where students write, "It will be a privilege to attend Harvard Medical School." Okay, Harvard already knows that it's great and prestigious. What the Harvard Medical School Admissions Committee wants to know is whether you are going to be a healthcare leader, and this is where the Harvard part comes in, how Harvard will help you become a leader. For example, let's say your vision is to improve access to female hygiene products in low-resource countries. Don't just say you're passionate about global women's health. Show how Harvard is the launchpad to fulfill your mission and vision. You could collaborate with faculty at Harvard's Public Health School to design low-cost sanitation interventions. You could also discuss how you want to work with Harvard's Global Health Institute to pilot a community project abroad, or to partner with the Harvard Innovation Labs to prototype sustainable menstrual products. That's the kind of vision Harvard gets excited about. It doesn't get excited about, "I want to do this research," or "I want to do this project at Harvard." But it gets excited about how you will use Harvard's ecosystem to make a very meaningful and memorable change. And that is how you show how Harvard will help you in accomplishing your goal as a future healthcare leader. Second, how do you show that you're a future Harvard doctor on your Harvard application? One word: leadership. Remember, leadership isn't just titles or position. Harvard doesn't care if you were the president of my Premed club at my university. Leadership at Harvard means that you will move the field forward. You identify problems in healthcare and you do something about them. Did you start a clinic initiative that improved access to care? Did your research uncover something that could change how we diagnose diseases? Did you build a mentorship system that lasts way beyond after you left your college? That is what leadership is. Harvard wants doers and game changers. They don't want people who just join organizations. They want students who actually transform programs and organizations. Make sure to discuss that in your Harvard secondary essays. So when you write your Harvard secondary, connect every single experience you mention to measurable impact. Show how you've already stepped up. Show how you've already made change. And then show how Harvard's ecosystem, its hospitals, research centers, and global reach will amplify that impact tenfold. Harvard wants to know how you've already achieved excellence and how you've already advanced medicine. That's how to stand out on your Harvard application. Harvard's 2 tracks, Pathways and HST. Now let's talk about something that confuses a lot of applicants. And I get this question a lot with our Cracking Med School Admissions mentees. Should I apply to Harvard Pathways, or should I apply to Harvard HST, or both? Did you know that Harvard Medical School actually has 2 tracks that you could apply to? Its Pathways program and the HST program, which stands for Health Sciences and Technology. Pathways is the main track. About 80% of Harvard Med students are in it. It focuses on clinical medicine, patient care, and leadership in health systems. You'll learn through case-based discussions, early patient contact, and small group discussions. On the other hand, HST is co-run with MIT, and it's built for applicants who thrive on science, including basic science. It's very, very research heavy. It's quantitative and also deeply analytical. Think bioengineering, data-driven physiology, and translational discovery. So how do you know which one fits you? If your passion lies solely on treating patients and leading teams in clinical settings, then Pathways makes more sense. If your drive is solving problems at the molecular level, then HST is a place where you'll want to innovate. No matter which one you choose, both tracks are designed for future leaders, people who will push medicine forward, whether that's through scientific breakthroughs or transformative care. And that's the real question Harvard Medical School is asking. How will you lead, and how will Harvard help you do it on a larger scale? Showing leadership on your Harvard Medical School interview. Here's what separates good Harvard interviewees from great ones. The great ones control and steer the interview discussion to highlight their leadership and impact. That's when interviewers remember you. Harvard interviewers aren't going to hand you a question like, tell me about a time when you were a leader. It's really up to you to bring in your leadership naturally. For example, if your interviewer asks, tell me about your research, don't just describe your research, show your leadership. For example, you might say, halfway through this study, our data collection system broke down. So I took the initiative to design a new workflow. It ended up becoming the model that our lab still uses today. That is leadership. If the interviewer asks about community service, display your impact. You could say something like, when I volunteered at a free clinic, I noticed many women didn't return for follow-up visits. I created a text reminder system that improved attendance by 40%. Again, that's not just showing your community service, that's really showing measurable change. The best interviewees integrate in leadership stories to any topic, whether they're talking about research or volunteering, or even talking about a time when they failed. So go into the interview with 3 or 4 activities that highlight initiative, leadership, and impact. Then look for natural openings to bring them up. That's how you control the narrative without sounding too rehearsed. Remember, use every interview question as a chance to prove that you're a future leader in medicine. To sum up, Harvard isn't looking for students who want to become doctors. Harvard is looking for leaders who will redefine medicine. Every part of your application, from your letters of recommendation to your essays to your interview, should really show initiative, reflection, and impact. Each year, Dr. Metarada and I from Cracking Med School Admissions help students stand out on their medical school application. Our contact information, resources, and links are in the description. I can't wait to start working with you.